I'm so glad you're joining me in the truck today. We are going to have a blast. Don't mind me, I'm eating my breakfast. I got oatmeal and strawberries.
Right.
Yummy. So, we are making our way to Laurinburg, looking at some Mammoth Jacks. But welcome to the life of Dr. Long, eating on the go. Hey there, I'm Christine Long, owner of Pineview Veterinary Hospital here in Bolton, North Carolina. We are an exclusive large animal veterinary practice. We provide 24/7 emergency care and routine services for horses, cows, sheep, goats, llamas, alpacas, and pigs. We are currently a staff of 2 full-time veterinarians, myself and Dr. Leslie Jarrett, and we have a wonderful secretary, Donna Jacobs. We provide veterinary services to the northeastern part of South Carolina and the southeastern part of North Carolina. So if the need arises, give us an opportunity to serve you. We are going to look at some Jennies, some Mammoth Jacks. This particular client also has Mammoth Jacks that he breeds, and we are going to pregnancy check via ultrasound some Jennies and determine if they're not pregnant. Also, he has a couple of Jennies that are losing weight, so we're going to look at their teeth, possibly do a couple of dentistries, and whatever else he's got to offer us.
This is Reba. Reba's 16-2 American Mammoth Jackstock Jenny. She's 4 years old and she's been choking. She aborted about a week ago, and we've had her endoscoped, and we really just don't know what's going on with her. She's never had a problem before.
Okay.
And
So what you have right there, as far as the peels go, that's perfect, and that's actually going to help her with the pain associated with any ulceration that's in her esophagus and maybe in her stomach too. And so Crowfate does a really good job of helping with the pain aspect of inflammation and ulceration when it comes to the digestive system in general. So that's wonderful. The main thing I'm worried about right now is, why she's re-choking, which it could just be because of what she's eating and the inflammation that's there, and kind of asking her esophagus to work normally. But the other thing is just checking her and making sure that she doesn't have any other things going on, like infectious causes that could be making her feel bad, and that's why she's not eating consistently right now. So let's take a look at her and see what she'll tell us.
Okay.
So on physical exam, she looks really good.
Yeah.
Her gum color is good. She's a little bit dehydrated right now. Her lungs are clear, both sides.
Yeah.
Her heart is great. Rate and rhythm are fine. It's a little bit elevated, but she's a little anxious at the moment. Her lung sounds are great. Her respiratory effort is not increased in any way. Her trachea sounds clear. Her temperature is 99.4. No fever. I know she's got some discharge vaginally, but usually when it comes to equine, if they get infection in the uterus, they're usually pretty fast to tell you about that. Unlike
Except remember,
cattle, they can kind of wall off and hold that infection
but remember,
to
the
themselves.
donkeys don't show you pain.
Pain
like
is
a
different.
horse.
Infection, they tend to show that nonetheless, infection-wise. So I can tell you physically, she looks okay.
She's losing weight. But,
She is losing weight, and she is thin.
But she's always thin. Like I say, a lot of, remember, it's not a horse. A lot of them are going to be raw bones, so she's not going to be round.
Well, and they don't come into
but
their
I
own
agree, she's
until
thin.
later.
Yeah.
She's still
Right.
growing. I understand. And she's been through a lot. Like choke, the thing about choke is it's very stressful on them. So the fact that you have her on the Crowfate right now, it is really, really good, and that's helping with pain. Here's what I can do for you. I'll be happy to run a quick blood test on her. It's right off the test. It tests for a particular item in their blood system that will show if there's any subtle signs of infection right now that may not be presenting physically yet, if they're there. If the value is low, then we don't have to worry about it, okay? And then you can sleep easier at night. least a little bit easier at
Yeah.
night, knowing that she's not on any antibiotics at this moment, and that's okay. Obviously, the main thing with her is her choking episodes.
Yeah.
And, you know, oftentimes when horses in general choke, they're almost always going to be repeat chokers.
Yeah.
It doesn't matter if they're a Mammoth Jack. It doesn't matter
Right.
if they're a mini donkey. It doesn't matter if they're a thoroughbred racehorse. Once a choker, almost always a choker. And there's different causes, right? Like there's some that wolf their food down. There's some that have bad teeth. There's some that get some pellets and they just choke on the pellets because it's a pelletized food and
Now-
it swells in their throat. Like there's lots of different reasons.
When I started introducing food back, what I would do is she still got her mash, but I started adding whole oats in it,
Right.
and she had no trouble with
Because
that.
they don't swell.
Yeah.
You know, the disadvantage to the oats is that she needs to chew a certain percentage of those to get
Yeah.
the nutritional value out of it. But the benefit is they don't swell like a pellet, you know. So I think a mix of both is
Okay.
going to be helpful for her to get calories and energy back
I'm like
in
you.
her.
I think it's when we introduced the hay, which Lord knows these donkeys got to have hay because they got to have the roughage.
They do. And I think
So-
that's where keeping her on the senior feed
Yeah.
is going to be helpful. Sounds
Excited.
good for you as far as what else
Blood
I can
work,
do
yes.
for her. You want
and
me
you
to do
think
that
the
quick
discharge
test?
is okay? So
Let's see what that test will tell us,
okay,
and if
And
there's
then
any
we can add the
indication, that's right.
antibiotics. Okay.
Yeah, because
That
I
sounds
expect
good.
her to have some discharge. She aborted, you know,
Yeah.
she's going to be expelling some things. If anything, we might want to give her a shot of oxytocin to kind of help
Okay.
bring things along.
Okay.
Okay, but she's not running a fever, and that's encouraging.
That's good.
So that'll be
For her to-
fine.
Being antsy as she was letting us know she didn't want this.
Okay. Reba, obviously we're concerned about infection with her because of her recent abortion and then recent history of repeated choking episodes. This test that I'm fixing to run is called an SAA test. It's made by a company called Stable Lab, and it tests for serum amyloid A. It's not the end-all be-all when it comes to diagnostic testing, but it is something that I can do in the field that will help me determine if an animal has something infectious going on or inflammatory. So I've taken a little bit of blood, put it in the pipette here, and I'm going to mix that with the solution that comes with the test. Takes about 9 minutes for this test to run. Got a nice little reader here. It's very portable. I'm going to pour out just a little bit and 4 drops. 4 drops right there on the cartridge, and we'll let that run. What I'm looking for is a value that is going to be less than 100. That would be ideal. Ideally, we'd see 0, and that's an indication that that SAA product, if you will, is not circulating in her blood system. And if that's the case, then there's less likely of an infectious component going on. Obviously, today, clinically, she looks okay. She's breathing normal. Her body systems all check out fine. She's not running a fever or anything like that. But I don't have the ability to run a chemistry CBC panel and that level of diagnostic testing off of the truck here. And Miss Beth is concerned that she's not on any antibiotics and she had a recent abortion in a week. So even though her body is not telling me that there's an infectious component going on, it's possible that there could be something underlying. This is something I can do right here off the back of the truck. It's fast. Takes about 9 minutes to run. It'll give me this value, and it'll give Miss Beth and I peace of mind that, you know, there is even less likely of an infectious component attributing to her offness, if you will. You got her on sacralfate, perfect. Finish that treatment out. That's going to treat the inflammation. She doesn't.
We didn't finish it out.
If you're working on it, she doesn't need any more Banamine right now. That's fine. I don't think she's in any pain at this moment. She doesn't have a fever.
I don't think I've got maybe 4 days, 5 days left.
And this test, 21.
It's saying what?
Good.
It's great. That's
Okay.
great. It's nice and low. And
No infection.
if it were like 300, 400, 3,000, something like that, then we would be missing something on her physical exam. I'm not worried about infection. I know she aborted. I think we leave her like she is. She's doing really well. Less is more as far as I'm concerned.
Are you thinking about a career with horses?
I love this. We love this. I love this. I love this. I love this.
We know. You'll love it too.
So we are still with Mr. John Cooley, and we are working to catch some Mammoth Jacks, some Jennies, to ultrasound preg check, about 10 or so of them for pregnancy. We've got breeding dates for when they were exposed to the jacks, so we're confirming pregnancies today. But then we also have another one that needs her teeth checked. She's losing some weight and dropping some feed, and we need to take a look at her. So that's what we're going to do this afternoon. It doesn't matter.
It's in the very back.
Yes, in the back. Okay.
You'll have to put the
All right. Let me grab some stuff then. I can smell. It smells like she's got some, well, not infection, but you can tell like when they hold feed or hay and grain.
I smelled it in her nostrils before.
Yeah.
When she first started having problems, you could smell it.
Yep.
Which is weird.
So when's the last time she had her teeth done?
A year ago,
Oh, okay. So it was last year.
maybe. Yeah.
Okay.
Yeah. We had her up in Virginia and they did it. She came down with an infection in her mouth. And they floated her and she got okay.
Did she have any trouble with sedation? Did they sedate her?
I wasn't there.
Oh, okay.
I don't think so.
Okay.
We've never had trouble with sedating them, to my knowledge.
Okay. Yeah. Oh yeah. Oh yeah. Oh, hold on. Yeah, there's fine. All right. Let's see if we can ask her to open her mouth for us and slip it in there. All right. Now you can cinch it down. Just snug. Good girl. Maybe you can do one more. Yep. Good girl. Say, not normal horses can't do this. Yeah, make sure we don't have your lips and your tongue. I know. You're a good girl. All right, let me get some, I'm gonna flush her mouth out. All right, sweet girl. Let's flush your mouth out. I know it. I know. I know.
This is why we need the honky so we can tie your head.
Yeah, well, and we can fit, we can get it back
Good
on
juice,
her.
It won't matter, will it?
Well, she's
This is a strong Jenny. Thank God she's so sweet. She's dropping a lot of grain.
okay. No worries. We can do this. It's fine. So what you got is a ramp. It's no longer a step. It's actually a ramp, but it's the last molar on her lower left arcade. Her left side,
Yeah.
lower molars all the way in the back. What's happening is where normally they kind of ramp just a little bit up, but they got that upper molar
Yeah.
to grind down, right? She's got that extra one, and so it's just going just like that. That's exactly what I feel. There's a point.
Yeah.
So what we need to do is take that down some. Yeah. And I would say if she's having a problem now and she had it done last year, then we're probably gonna have to make this an annual event.
Yeah. You don't think we need to take it out?
No, and honestly, I'm gonna tell you, the only way to get that molar out of her head is to put her through surgery.
Yeah.
That's right. It's so far back in the head,
Just float it.
you can't do it like, you can't take it out with her up like this.
Okay.
There you go. Just put your hand right there on her, the brim of her nose, just to keep her from throwing her head back this way. Don't let her hit you now. Good girl. Okay, let's let her get that sleepy. So what we have is Miss Greta has got she's got an extra tooth in her head that Miss Beth and Mr. John discovered a while back, and essentially that extra molar doesn't have an opposing tooth above it to grind, and so it's on the left side of her head, lower line of teeth, or dental arcade as we call it, the last molar in that line. So she is actually doesn't have any tooth to grind against, and so that molar is just growing and growing and growing and doing its thing, and it's created a sharp point that is jabbing her gums and causing her discomfort when she eats. Case in point, why she's dropping feed. Case in point, why she is experiencing some weight loss. So we're going to float that down, and we're going to take the power float, we're going to grind that molar down, make her mouth otherwise is actually pretty comfortable. I'm going to grind off a couple little areas just to make sure we're not missing anything, tie her over for another year, and then she'll be good to go. But we'll have her on a schedule annually to maintain this one tooth. I'm a wife. I'm a busy mother of 3 beautiful children. I am a life and fitness coach where I inspire others to be the best that they can be every day. I'm also a full-time business owner and veterinarian, large animal veterinarian. I am Dr. Christine McPherson Long, host of Heard This. Come and ride with me, your rural Carolinas large animal vet, as we cover roughly a 900 square mile radius in both North and South Carolina. Every day's an adventure. Just pull it out right there. That's fine. You know what this is, sweet girl. You do. She's got 2 problems, Miss Beth. Okay. She's got a ramp on that back side, that lower. Right. And then she's got another tooth on this upper right back that's longer than normal too.
You reckon it's not closing all the way because of the other tooth? So it doesn't get ground?
I think what feels to me, let me see if I can open her up a little bit more. What feels to me is that just one click. Okay, that's good. You got 5 on that side?
Yeah.
It feels to me like she broke off of the back side of the bottom molar on this right side. Yeah. So, because it's just a piece of that upper last one that's overgrown.
Okay.
All right, let's see if I can.
Well, good. We can move the pile.
Yeah. I'm able to get on top of that. Yeah, we're getting it, and I'm not gonna be able to make it all the way flat, but I can make it to where it's not as uncomfortable for her. Good girl. I know. I know, I'm gagging you. I'm so sorry. Wow. Okay. That one side's done. She is gonna feel so much better after this. She really is.
Yeah. She doesn't enjoy eating like she normally does.
No, well we've got, she's.
I've actually been scared to put the bit in her mouth in case there was something that was gonna bump.
She's gonna become, now, you do know she has wolf teeth.
Yeah.
Okay. She's got those first, they look like little canines,
Yeah.
but they're very established. They don't seem to be bothering her at all. So sometimes those wolf teeth will hit the bit, and because they're a single rooted tooth, they it's bothersome when the bit hits. Man, this thing is fancy. That got a fancy power float now. Huh? A kid with a new toy, that's right. Did you get that picture? All right, let's get this ramp in the back. That ramp in the back was right up against her gums. Okay, that ramp in the back was right up against her gums. So that's where this blood is. Okay. In order to take it down, it's hard not to hit the gums at the same time. Yeah. It'll heal just fine, but it wouldn't be a bad idea to give her a little bit of bute today, just to help. But that feels wonderful. You did good. You did very good. You did good. Her mouth might be just a little bit sore, but we got that step, the ramp, all the sharp points. She should be good to go. So we just finished Miss Greta's teeth, and she did very, very well. You may have noticed that there was a little bit of bleeding after this particular dentistry, and that sometimes happens. There are certain molars that are right up against the gums, and sometimes it's really hard, even if you try your best to not hit the gums. Sometimes it happens. What we're going to do for her, just to kind of make sure she's comfortable, is we're going to give her a little bit of a pain medicine, phenylbutazone. Just a low dose this evening and again tomorrow morning, just to kind of help with any discomfort that may have been created in her mouth. That should be it. She should be good to go. She doesn't need any antibiotics or anything like that. Otherwise, she has a very, very healthy mouth and should be good to last another 12 months until she needs her teeth done again.
The rural American lifestyle. It's how we work, and it's how we play. It's how we learn and how we enjoy the finer things in life. How we take care of our animals and tend to the land. It's a way of life. Has been for hundreds of years. Now there's a whole new way for rural America to watch TV.
So whenever we ultrasound or whenever we pregnancy check horses, donkeys, Mammoth Jacks, whatever, it's important that you be gentle. Their rectal tissue is a lot more friable and thin. So if you noticed in other times where I've been preg checking other animals, I don't clean the poop out. I always will on an equine because I don't really want to put any more pressure in their rectum and their rectal tissue than what my hand is already going to do. And feeling around poop fecal material can do that. So I clean them out. I'm very gentle, use lots of lube. I'm gentle with cattle too. Because it's stressful. There is a certain amount of cortisol release, stress release when it comes to rectaling anything. But horses have a tendency in general to be a little bit more sensitive.
Also, it's filled inside different, deeper.
Bouncing a baby. Pregnant. This far along, I looked at Patty's dates. You got September, so you need to say a prayer that it's just one.
This one need to check if they got twins, right?
There's nothing I can do about it even if they're there. She's too far along. That's something, twins would have been something I needed to ultrasound her within like 2 weeks of exposure, 2 weeks of pregnancy. It's okay. It's mostly hay anyways.
Then you gonna have them. I can see it to the barn. They ain't gonna have not. They'll be drying today.
Let's put that up there. You're a good girl. So you said November to December? Good girl.
You wanted that right here?
Yeah, yeah, that's perfect. We'll move it out of the way as we need it. Did you get splattered, Miss Beth? That's funny.
Right there, right here. No, I'm just messing with you.
They had her before she could think about it, too.
I cannot see that thing. Wait a minute. Oh, yeah, that's helpful.
Can you see it good enough?
Uh-huh.
I got a blanket in the car.
It's okay. I think you got you a baby right here.
Awesome. One Hank, baby.
We got a bunch of fluid.
Look at her.
Looks like it's moving, isn't it?
Doing back there.
How many days?
When's it
It's a large enough baby to fit the timeline as far as exposure. So what, November, December, January, February, March, 4 months is roughly. I think, didn't you say November, December?
Yep.
Yeah, there's your spine.
Baby? Summer baby?
November, so she'd be October. She'd be late fall, or excuse me, early fall, right? She'll carry a year, roughly.
Sure, November.
Yeah. Congratulations.
Since it takes a year.
Yeah.
But you know,
I don't need to scan her. She's, yeah, big old baby in there. I know we don't know who exactly she is, so we don't know our exposure, but this is big baby. Horses really are not designed to carry multiple babies. God really created them to just be singleton, parents, if you will. It's not that they can't, but their bodies just really aren't designed to hold multiple fetuses at one time. Twins in a horse, donkey, mammoth, it doesn't matter. They're really just not designed to be able to sustain 2 offspring at once. It puts a lot of stress on the mother, it puts a lot of stress on the babies, a lot of mammary requirements and just lactating and calories and nutritional sustainability. It's very hard. So ideally, if you are breeding horses, you would want to have them pregnancy checked via ultrasound by a veterinarian to check and see if there are 2 embryos developing. And if there are, have a conversation with your veterinarian about what that means. Ideally, we would not want that mare to fully gestate or continue to develop both embryos. So you may have heard people talk about pinching one. It sounds very, I don't want to say archaic, but and unnatural. But if the alternative is for a mare to have 2 babies and both babies, or a Jenny, both babies carry to full-term gestation, end up being delivered and then die, which oftentimes ends up being the case, and then there are no babies, or if veterinary intervention can occur early on in the pregnancy process to where one embryo can be eliminated, then one fetus can continue to develop all the way to term, be born and be alive and have a sustainable full life, then I'll take one versus none. So it's a very hard decision to make, and it's hard for owners to make. I get asked all the time, you know, how do you choose one embryo versus the other? There's no science behind it. Oftentimes both embryos look good. It's just a matter of isolating one from the other and eliminating that one from the process. So fortunately, I do not have to do it hardly ever because horses are designed to mostly ovulate once. They usually grow one big follicle on an ovary, and then they ovulate that follicle that meets with the sperm and then creates a nice embryo. That happens in a singleton type of action in the horse. Whereas lots of other animals, dogs for example, even some humans, they ovulate multiple follicles at once. So multiple eggs are allowed to be fertilized, and then you have a higher rate of multiple pregnancies for other animals. These are good donkeys. Is it appropriate to call them donkeys, Beth? Beth keeps me straight on my terms. I've learned a lot about Mammoth Jacks in general and the differences between them and other donkeys. You should get a lesson on terminology from Miss Beth as far as males and females and what they're supposed to be called. I couldn't do it. If you asked me a quiz right now, I would probably not pass. You schooled me last time I was here.
A John from you, Molly's from you.
Wait, slow down.
A John is a male mule.
A John is a male mule.
A Molly
A Molly
is a female mule.
is a female mule.
A Jack is a male donkey.
A Jack is a male donkey, and a Jenny is a female donkey. Got it.
And all ours are mammoths.
Which is a breed.
Yes.
Hey, you're fine. Okay. You're all right. You're okay. Oh my gosh. Look at that. She's pregnant. The baby is kicking in my hand. I just wanted to see it because she has so much poop there. She's like, leave my baby alone. Is that the last one, Miss Beth? Can I turn the machine off? Hopefully, how many we got?
12.
We only have like 2 open, I think.
Yep.
Out of maybe 12. So that is awesome.
I'm gonna take that to the front.
Okay, Don.
Oh, good girl. So that is Mammoth.
We got 7 pregnant.
7 pregnant out of
12.
12.
We checked 12.
That's not too bad. That's great. And all the pregnancies are live. All the babies were moving. And these girls look great. We'll circle back at some point in the future and hopefully do some more preg checks for any of the other ones that are being exposed now. So you're going to have a busy fall. That is a day. folks, I tell you what, we have had a jam-packed day, and I could not have asked for it to be more productive and better. Got to see lots of different people today, do lots of different skills, and help people in so many different ways. I cannot thank you enough for joining me in the truck. I hope you have had just as good of a time today as I have. Don't forget to check out the Heard This Facebook page. Check out the Pineview Veterinary Hospital Facebook page. Follow me on my personal Facebook page at Christine McPherson Long. And as always, you're awesome. Thanks for joining us.